What is going on? This is Sam Kunov, Sam OK Fit, checking in with you guys. You guys are doing well, doing terrific, and we are back with another video. I've not made that intro in a while, but in today's video, I'm going to take you guys through a strength training workout because a lot of you guys still care about training. I know it's not going to be a running content, not running content just yet. But we're going to take you guys through a shoulder workout, and also I'm going to be answering some questions. So I went on Instagram and I asked people to ask me any questions, and because some of the answers that they gave are relating to questions about strength training, questions about running, questions about injury. So I want to use this opportunity, one, to take you guys through a shoulder workout and answer some of those questions because I think a lot of you guys are going to get some value from that. And after this workout, I'm going to take you guys to my PT because I have a PT session with my PT today. Yesterday, I was doing some mobility, and this past weekend, I did a 30-mile run, which you should probably have seen already. If you have not, after this video, go check the other video out. I'm going to see my physical therapist, whom I see once a week, just to make sure my body's still right. And I have a little bit of groin or hip injury. It's annoying, let's just put it that way, that I'm going to be working through. And also I'm going to be asking them, giving you guys some tips that you guys can use that are battling or go through injury, some things that you can do, especially when it comes to running or just strength training in general. So it's going to be a video that's packed with a lot of content, a lot of value. That's what I want to bring for you guys. And if you're new to the channel, give this video a thumbs up and make sure you click the subscribe button and turn that post notification on so you can get notified anytime I'm dropping a new video. Without further ado, let's jump into a shoulder workout. Right, so the first question is coming from one of my clients, saying any recommendations for athletes training through an injury. So this is a good question. So the first thing I would say for anybody training through an injury, let's say traumatic injury. And what I mean by traumatic is, let's say you're running and you just hear something snap, or you roll your ankle, or things like that. When you're training through a traumatic injury, back in the day, the term RICE, R-I-C-E, meaning rest, ice, compression, and elevation. But lately, in the last few years, that has been kind of not debunked because there's some element of those terms that's still applicable. But what you want to do is you want to get that joint or that ankle to be as mobile as possible right away. Of course, you might be limited because if it hurts, you cannot really do much about it. So looking for things you can do or finding ways you can still get some sort of range of motion to that particular injury right away will be beneficial. But also, one of the biggest things that I learned, that I wish I learned when I first started my fitness journey, was understanding when your knee is hurting or a particular body part is hurting, it's not necessarily that particular part, it's a symptom of something else. So if your knee is hurting, for instance, it might not be your knee. It could just be your hip or internal rotation of the hip, external rotation of the hip. It could be limited ankle mobility for people that are strength training that suffer from knee issues. So those are the two key tips I will give to you. One, try to get that joint or that injury as mobile as possible. And two, when you suffer any sort of injury, it could be elbow, could be a lot of joint injuries, most of the time it's not really the joint that's hurting. The joint is hurting because of symptoms or limitation of some other body part. All right, so the next question is coming from Lex_LaRue, if I'm pronouncing that correctly. So the question was, best way to balance running and strength training. I have a video that I'm going to be doing dedicated, and I've done videos in the past talking about what's the best way. And obviously because I run and strength train at the same time. And one thing I would suggest for you, again, I have a reel on Instagram that I talk about this too. One thing my biggest suggestion is you cannot burn candles on both hands, right? You cannot be 100% at running and 100% at strength training, and you'll expect your body to be able to handle both. So my best advice for you is, one, have priority matters. And what I mean by priority matters is, what's your main priority right now? Is your main priority right now to be a strong runner? Is your main priority right now to get jacked? So once you can figure out what your goal is, then you can kind of segment that together. What I mean by segmentation is, the next 6 months, my primary focus is going to be strength training. Yes, that means that allows you to shift 70% of your effort towards, being strength training, and 30% of that should be towards running. Meaning you're not running high volume on running and you're running all the miles, which is just a recipe for you to get hurt. So one, have a priority. Which one is your priority? Whatever your priority is, that's what gets the biggest percentage of your effort. If running is your main priority, you do a lot of running, and you just use strength training as a way to support yourself and make sure you're not going to get hurt. If you want to get jacked, you spend 70% of your time all your volume, shift towards that, and you do the minimal amount of running that's enough for you to be able to recover from your strength training. Like for me, for instance, I have adapted to be running 40 plus miles per week, and I still manage my strength training. And my goal right now is obviously running, so the volume when it comes to legs is lower than what it normally was before. And when I was bodybuilding or contest prepping, my running was a little bit lower to the point where I can still strength train at the same time, and it's not going to be taken away from my leg training. Anyways, hopefully that was very helpful, and we are going to be jumping into Smith machine prep. Okay, so the last question I'm going to be answering, because a few other questions were kind of relating to the last question, talking about how to balance running and strength training. So the last question is coming from Gus Ortiz _12. The question is, new to running, 6 months. 6 months here, but keep getting shin splints and any good exercise to strengthen them. So shin splints and plantar fasciitis is almost like a rite of passage for most people when you first start to run. So you got to understand something that, one, your shin, your feet is not strong enough. It's almost like showing up to the gym, you haven't been trained for a while, 100 pounds used to be your max, and you show up to the first time, and you haven't trained like 6 months, and you show up for the first time and you expect to do 100 pounds again without possibly getting hurt. But when it comes to running, your feet is not strong enough to be able to handle the impact that you are applying while running. Same thing goes for shin splints too. So if you have shin splints, the first thing I would definitely want to do, you want to get into some tibia raises, because one, it's going to strengthen those shin muscle and obviously help you when it comes to knee stability and knee health too. And two, I will look at your running form. Is the contact, are you heel to toe, are you gliding, or are you landing when it comes to your midfoot when you're running? So two things you can do, I would say, one, look at your running volume, and also most injury typically occurs from improper technique over time and poor load management. So poor load management can lead to shin splints. Again, if you haven't been running for a while, like you said, 6 months, my guess would be you probably started with tons of mileage right off the bat without easing yourself into it. So two, I would say lower your running mileage, and two, get into some tibia raises. So lower mileage allow you to slowly ramp up and let your body adapt to the volume when it comes to running, and two, strengthening that muscle that you're using to run will be the two suggestions that I'm giving for you. So next movement, upright row or wide raises, just to hit the rear delt and the front delt. Right, so that is arms right there. I mean, again, we finished with the arms just because I really train arms. Arms is one of those body parts. There are certain body parts where you have more opportunity to take into failure most of the time. Legs is not one of those, just because it takes a lot longer time to recover. Back, it takes longer to recover. Chest, it takes longer to recover. So arms and shoulders is one of those things where, if you're lagging in that area, you can definitely push and take them to failure. So yeah, and when it comes to, since a lot of questions that was asked today was related to a lot of injuries or managing strength training and running, my biggest advice really is to you, one, you have to try and see what your body is able to handle. So if you're trying to wait for like that perfect split, or the perfect split or perfect balance between running and strength training, you're just gonna spend a lot of time trying to like wait for the perfect opportunity. But there's no such thing. You can try trial and error. I did trial and error with my strength training and my running. Of course, I had a running goal, and when it comes to like strength training, I'm like, okay, how can I manage this? How many sets per week do I need to take my legs through for my legs to still be able to show up to the gym, train all the time? And the biggest tip I would definitely share with you is you definitely want to track your volume. If you don't know how to track your volume, it kind of makes it harder for you to manage both. So my suggestion, track your volume, and sometimes you just got to experiment. So finish with the training, and now let's head on to our PT session so we can sort out our knee. I'm going to be asking my PT some tips for you guys if you're battling through a lot of injuries and what to look for.
We'll do a little muscle testing second,
okay,
but on their back though.
On back?
Yeah. So I'm going to bend here. I'm going to start palpating through this direction.
I just feel sore, like a normal muscle soreness.
Like you trained it, kind of thing. When you're doing it though, how far up do you feel it? Do you feel it more like medial, or do you feel it more higher into the groin?
More medial. It's more like actually in the back, so it's more. I would say more the hamstring.
Okay. So we got that tissue. We're gonna go in the middle now. I feel there's a little inflammation there. I'm gonna pull your heel here. Resist me. Don't let me pull. Any strain there?
Too much strain, but like on a scale of 1 to 10, I'll give it like.
I'm gonna go here. I'm gonna pull here. Resist now. Same story. That close.
Yeah.
Okay. I'm gonna pull this knee here. Resist me. Don't let me pull. Any strain there?
No.
One more time. Okay. I'm gonna pull your leg here. Resist. Don't let me pull.
Okay.
Anything there?
No.
Okay. Last one. I'm gonna pull right here. Nothing there?
No. Also on the medial side of the knee, like pulling nothing.
Like through here?
Yeah.
Okay. Yeah, people just don't want to do it sometimes. They want to, I don't know, this is fear of, one, finding a provider. That's kind of scary, right? Like
Yeah.
People don't like that. They don't trust anyone nowadays, just sort of government and everything caused that, the lack of trust. And then just the horror stories of doctors and pharmaceutical companies, but that's a barrier. And another barrier is like, they don't want to spend money.
Yeah.
But then if you want to do something, though, like, again, time is money, right? So you're just wasting, lingering, you're not optimizing yourself for that time while you're trying to like avoid. Plus, like, you just waste mental capacity that you could be focusing on, right? Nutrition, timing of nutrition, and sleep and family, besides your health until you're sick.
Yep.
And the only thing that matters is your health.
Yep. Like, what would you say is like the most important thing as far as trying to find like the right like provider?
I think the first thing you got to ask is what kind of provider they are. Like most people, they call and ask, "Do you take my insurance?" And like you got to get rid of. You got to stop thinking. Well, that's an important question for sure, but you can't stop there. So you got to ask them next is like, all right, what kind of treatment do you do? What kind of interventions do you do? Right? Then you got to ask them, have you worked with anyone that's done my sport, whether it be a running sport or a fighting combat sport or a soccer sport? Okay. Yeah, that's all right. Do you have a lot of experience with the return to sport phase? Again, if you're a high level athlete, you don't want to go to a geriatric PT or a pediatric PT. You know, you want to make sure they actually are seeing that and they understand the return to sport protocol. That's the difference between like a sport chiropractor and like just a family wellness chiropractor, you know. It's finding out if they actually treat you, not they just don't take your money, it's a transaction. Yeah. And then when they do treat you, is like, is it one-on-one care, or do I work with a high school PTA student, or someone count my reps for me? Is like, are you printing out a sheet? You're gonna give me something that's not like prefabbed, or is it individualized?
What's your take on the rice method? That's like a means of treating you.
I'd say it's like there's caveat, and always it depends, right? Yeah. But for traumatic injuries, there's a different story between non-traumatic injury. Most injuries are not traumatic injuries in the sports world, like overuse injuries, right? They're gonna happen from repetitive trauma. That's much different. So if it's like an acute trauma injury, like ice is really good. You know, rest, it can be good, compression, elevation. But for overuse injuries, ice doesn't do much. It's all purely palliative in the sense that it makes you feel good. But it does not facilitate any recovery, more so than not icing. If anything, it's been kind of shown to sometimes delay the process because, you know, inflammation is good to an extent. You want to control it. But when you use ice after a traumatic injury or after an overuse injury, it just constricts the area and reduces blood flow. Gotcha. So it doesn't help with all the different type of white blood cells, red blood cells that need to go to the area to repair. Yeah, movement. And movement doesn't always look like with barbells and weights. Like there's a passive and unloaded movement, right? That type of stuff for an acute injury, like for example, an ankle sprain is like cars, controlled articular rotations, like passive unloaded ankle movement, just get some blood flow to pump up and your lymphatic system to drain. For tendonitis, you know, we found rest is not the thing either. It's all about load. Any kind of tendon issue, if you rest it, you're never gonna heal it. It takes amount of load and traction to change the collagen. But my rule of thumb for people, I said if it's an acute injury, 24 hours, sure, you can ice it. But you definitely need to move it too, to a degree. If you don't know, you should always get ruled out by a provider. Make sure you rule out your red flags, but you never need to rest it. I'm gonna pull your heel here, resist me. Okay. I'll just like a frog leg. Poor load management and improper technique over time. Poor sleep. And then poor nutrition. You know, sleep's like a pillar of health, a huge pillar. It's like low-hanging fruit though when it comes to performance, or you know, performance-enhancing drug is. People want to take all these supplements and they want to take all these peptides and all this stuff. It's like, all right, hacking, cool, you can do that. Or you want to, you know, rejuvenate, Wolverine, peptide, get it. But how are you sleeping, dude? You look at your phone before you go to bed? Are you in a hot room? Do you wind down properly? Are you in front of light all night until you go to bed? Proper sleep hygiene is huge and important, and it's what makes good athletes great. Supplements is easy, but getting away from your phone before you go to bed and talking at nighttime instead of looking at a screen. And then some people, they want to train like champions, but they want to eat like assholes. You know, that's the other part of it. It's hard to say like one thing is the reason why people get hurt. It's so complex. Our systems are closed, you know. We can theorize on it. Injury prevention is a fallacy as well, because there's no way you can prevent injury. You can reduce the risk of injury, but you can't prevent it. Glad you're educating people though on all this stuff. One thing you got though, you know, you're in the trenches though, so people do respect that and they want to kind of pick your brain on. I'm pretty sure that's why, because you're actually in the trenches. There's a ton of doctors out there that are never in the trenches, and they just prescribe and talk to people on theory. They have no application. Right, there we go. Relax the head. Here. Now we're gonna go right over here. How does that feel with it stretched out?
Good.
So that was more worried about you going that way, to be honest. So this one, probably just from the needling, the pressure there.
Yeah.
Do you have any of those floss bands at home?
I do. I have not a thick one, but
Like a 2-inch one?
Yeah, the 2-inch one.
I would put that on there and then just kind of mobilize, because it's pretty superficial. It wasn't deep. That floss band though will be killer.
Awesome. Cool. Thank you.
Yeah, man. Go time.
10.